All right, so welcome. We're starting with our essential oil blend. I've chosen neroli as a great oil for anxiety and stress, a nice oil for females for their hormones. And then I chose frankincense, wonderful for aches and pains, sensitive skin, very grounding, great anti-inflammatory. Same for Palo Santos, another great grounding one, great one for rheumatism as well. It really opens up the lungs, and since scoliosis has to do with compression around the thorax, that's a great choice as well. I've got a little bit of cedar wood here, and I'm just blending that with the carrier oil. Got a blend of macadamia and jojoba for my carrier. So I'm just going to apply this blend. I've already checked with her. We've worked together before, so I know she doesn't have sensitivities to these oils and doesn't dislike the smells. Important things to check in. Once the oil is all over the back, I'm just going to start into maybe a few reverse effleurages. As you're doing this, keep in mind that with scoliosis, it's a lateral curvature to the spine. It could be an S or a C curvature. So you're looking at working with more pressure on the side that's compressed. The other hand is doing the same movement to relax the mind and the body and to find symmetry, but essentially it's working superficially. So with Rihanna, her right side thorax is elevated, which is my left hand. So my left hand, which is probably your non-dominant hand, is going to be working with more pressure than your weak hand. So you really want to be conscious of that. It's important to work with deep tissue on her tight side, and the other side to work really lightly, even though you're going through the same motions. Here I'm just pushing down on the hips on the SIs, looking to find a little bit of length in there. Same thing with the upper trapeze and into the neck. So the whole while I'm mindful that the tight side, like any muscle, has an agonist and an antagonist side. So the agonist is the contracted side, the antagonist is the lengthened side. You always want to work deeper on the contracted side to lengthen the contraction. The other side is overstretched. It needs strengthening activities to it. So I'm just going to work superficially with my hands and send them home with some home care advice to strengthen their weak or non-dominant side. So you'll probably find scoliosis often on their dominant side, which very often might be on the right side. Not always, so you want to do that test at the beginning to check in. So I went through warming up a little bit with the reverse effleurages. I'm just doing some petrassages with my thumbs. I don't know if you can see that, but you can use your thumbs. Now I'm starting to use the thenar, the web, or the wad of muscle in my palm. And again, more pressure on the contracted tight side. With scoliosis, sometimes you'll feel swollen lymph node in areas where the bends have happened for a long time. So as I go through her neck is really tight, and I can feel that there's these kind of round tapioca or grape-like sensation to them. And swollen lymph nodes are an indication that something's been irritated for a long time, or something's off there. The body's trying to fight it. It's bringing its white blood cells to the area to help to find balance and help to flush out toxins if there's toxins, or bring more fighter cells to an area. So how you can help reduce the stress on your body, vertebrals, muscular skeletal system, nervous system, on all of this is to strengthen your weak side. That's with anything, but with scoliosis it's progressive, and so it does get worse over time if nothing's done for it, and people start to lean into the angles to avoid pain, which accelerates the progression of that lateral curvature. So to maintain this, it's really within the scope of practice of massage to help lengthen, but also very much in the healing scope of an individual with scoliosis, if they're adhering to that home care advice to lengthen the compressed side, whether that's using a foam roller on that side regularly at home or maybe a massage ball, and to really work at the gym, maybe double on the weak or non-dominant side to help strengthen it. So we've done a few effleurages and petrassages. Generally you're starting towards the heart after that, even though my focus is the ribs and I want to go there and I know I can do some rib raking and open that up. I'm going to open up closest to the heart where the blood already is, so we'll start with the neck and the upper shoulders. As you're coming up and down, let your fingers really lengthen. If you're feeling ripples and popping in that area, see if you can slow down. Man, your neck is so tight. Slow down and feel where there's moguls. And this is an S-bowing and C-bowing technique, so I feel like the right side of her neck is very tight. And I'm just grabbing it essentially like a pincer grasp. Yeah, and stretching it to be either a C curvature or an S curvature. So something similar to scoliosis in a way, that S or C curvature, but using that on the muscles beside the bones, beside the vertebrae, and just holding it and inviting length to that muscle belly or to that tendon juncture. So that was S-bowing or C-bowing. And then I can go back to kneading and offer some length. Just give it a hold. And then you can come into your shoulders. As you're coming into your shoulders, I might work the looser side first so that I can see what is loose, what is relaxed, what is her normal or even more lax state. And give it a little stretch by depressing the shoulder back and down away from the ears. And then I'm going to walk around and do it to the tighter side. So in general, you want to work on their normal side first, whatever normal is, and then go to the dominant side so that you can see what is overworked and what feels a little bit more stringy, taut, or tense. So as we're coming into kneading, again, I can grab the upper traps and S-bow it, C-bow that trap. I can slide under the shoulder from the anterior deltoid and depress the shoulder and give it a gentle traction to pull the shoulder away from the ear. So I know that this side, the shoulder roll rides higher, and essentially I want to do more stretches on this side just to encourage deep diaphragmatic breathing as you're doing it, and that can help lengthen the muscles. And maybe to let your client know wherever you feel that it's tight or that you feel the stretch coming from, see if you can take a deep breath and send the oxygen to that area, inviting it to give a little bit more length. And supporting the system structurally, listening to the body when it's had enough of a stretch, so let it go. Stretch should not shake. If you are shaking in a stretch, you went too far. The body's asking for release. So now I've pulled down on this shoulder, lengthened through this area. If it was really tight, you could go into pressure point work, whether it was 1 or 2 fingers away from the neck, or at the tip of the acromion where the bones meet to come in an inch is that second pressure point. And both of those are easier to trigger from this direction using your thumb or bending a knuckle and having the knuckle go straight in. On their exhale, as they inhale, I ease off half of the pressure. As they exhale, I lean back in a little deeper. And last time, deepest of the day. So that pressure point is saved for the tight side of the body. There's no point in doing it to the other shoulder because it's not the dominant shoulder. I'm looking to find symmetry, so one side's going to need more work than the other and deeper work. After pressure point, stretch it out manually a few times. So you might have opted out of that pressure point. She didn't really need deep work, so I just kind of did a pretend one for all those learning at home. And I'm just starting, you can see, to get under the scapula itself and loosen up that vertebral border of the scapula. And after a few times of coming in, I start kind of probing around with my fingers underneath the blade. And I'm looking for where there's tension. If you feel something ropey, you can stay there, you can oscillate, vibrate in that area. Oscillation's the other finger from my right hand that's going back and forth. That vibrational work helps to relax them and helps you to get into the muscle belly a little bit easier without resistance or with less resistance. So after that, I'm going to stretch out the blade. This is like spinning a disc. So my inside hand is my left hand. It takes the V border of the blade and pushes it in towards the neck and spine. My outside hand grabs the top of the shoulder and pulls it down as I'm turning in with my bottom hand. Then my bottom hand's going to lift up a little bit as the lateral border of my hand cuts into the vertebral border of the scapula and pulls towards myself, and I'm leaning back. So it's like a little chicken wing that you're really loosening it up, and there we go is the full extension of it. So it goes in and out and in and out. So wonderful rotation. And then once you've got that, you can do a nice circle one way or circle the other way and end by pulling out. You can also come into the armpit, and we're going to teeter-totter where there's no turning, there's no gripping with fingers, but my hand is going to slide into the armpit and roll the bicep out, and the bottom hand on the outside is just above the elbow, and it tucks it in as my top hand pulls out. And what that does is really open up the glenohumeral joint. So in this joint here, it helps to release the tendons that can jam the arm together. That's a really good technique for frozen shoulder as well. So you're lengthening that glenohumeral joint essentially by having a teeter-totter with your arms, and that'll stretch this area out. So you might hold it for 6 seconds and do that 3 or 4 times. So that's lengthened this whole top of the scapula, upper traps, and neck. And you could, again, do some superficial stuff to this side to warm up the tissues, increase circulation, and to help her feel balanced on both sides and symmetrical. I'll just take another minute or so and offer a little bit of touch to this side. So it's not that I don't want to work on the side that is overstretched, I just want to work it really light. If you had music on, you'd be moving to the slow rhythmic music. I just don't have it on so that you can hear me. And then, so from this shoulder blade, I'll close up the upper back. There's our half back sweep. One way all the way up the neck, and then from the neck, alternate your direction and take it from one shoulder across to the other, and from one bottom of the blade to the other bottom of the blade, and slowly returning lighter even yet all the way up to the neck. So we've completed the upper back, yeah? Now we're into the thorax, and this is where we really see that rib humping. So my fingers can slide between the ribs and pull towards, while the other fingers are going to push the intercostal muscles and lengthen them in between the ribs. So I'm coming on an upwards angle, following, let your fingers fall into the ribs, lean back so you can really feel that, yes, I'm in between those ribs. And then take the opposite hand and trace in between the ribs until you can't get in any space, until you get so close to the vertebrae that you're on the erector muscles and there's too many muscles to get in between. This is a fantastic technique, great raking technique. You're raking in between the ribs, and it really opens up the intercostal muscles. These are your secondary respiratory muscles. So they help you breathe. When you're crying, you use these a lot. If you have asthma, you're using these a lot. If you have COPD, chronic obstructive pulmonary disorder, emphysema, any respiratory disorder that's chronic, this is a great technique. You can also cup that area. So this is tapoma, rapid springy blows, and they're done for half a minute to 2 minutes on the side that needs tightening. So this side is actually compressed and it needs lengthening, and we lengthen those ribs by doing the intercostal rib raking. On the opposite thorax, that is the overstretched side and needs to be tightened, the tightening technique that we can do is tapoma. So for half a minute to 2 minutes, you might do this. And this is a great technique. I'm going to show it over here just so you can see it better and a little bit differently. So that was cupping, where I was cupping air. And if I'm cupping with a little bit of a push up, I can really dislodge mucus off the lungs. So it's a really wonderful technique that nurses use to dislodge congestion if you have a lot of catarrh buildup. And you can hear that it's got a bit of a different sound. That first one had kind of a cupping sound, and this one has a slap or a pop to it. Because I'm pushing up with the base of my hand, with my palms, to dislodge that mucus. So it's a little bit more of a pushing up, whereas the other one was more of a cupping. I'm going to soothe that area out. So just to say, there's 9 different types of tapoma. Those two, clapping and cupping, are great to use through the thorax on areas that are congested, lung congestion, or to strengthen the weaker side. So I use that on her left side, as her right side is very tight and her left side needs to be strengthened. So that's one strengthening technique. The stretching technique, or the deep technique, was the rib breaking. And if you find the erectors tight, you can do pressure point work, and you can see how tight these are, that as soon as I go over them, they create a hump. And whenever you see humps when you're pushing on muscles, that's an indication that there's a lot of tension in that area. And so it can be worked on quite a bit. So instead of doing deep pressure point technique to erectors, which might be tender, I find it's less invasive to use the thenar, the wad of my thumb. And I lay both my thumbs down, and I can just kind of rock with my body's weight. And as I'm doing that, I'm pulsing the erectors that are holding the spine so tight, and encouraging them to lengthen. And I might go up and down that thorax from the bottom of the ribs up towards the top of the scapula, and go back and forth a few times. And essentially I'm just coaxing the muscle to relax, compressing it, and encouraging it to soften. Generally, when you do something 3 times, it seems to set some kind of a mindful pattern where the body knows what to expect and can relax into that. So keep that in mind. Your sequences should be done in sets of 3, or at least in 3. So after I went up and down, up and down, up and down, I'm going to lengthen that area manually, which I might avoid doing to the other side. So I'm taking my palm, the pisiform bone off the medial palm, and pushing down on the SI, or lengthening down to her toes from her hip bone, and my other palm is gliding up. This back hand's pulling back, offering resistance, and the top hand is really leaning forward to open up and lengthen, offering traction to that tension. So I'm going to come right to the mediast of the rib humping and manually offer traction just to that area itself. And the other side doesn't need it, so I could just do one light stretch or maybe even 3 again so they feel equal. But these are non-intentional, more of just connecting with them and having touch, but not a deep stretch at all on the opposite side. All right, and so the other thing you might look for is the hips. Are the hips in line? So we look, do the hips come across and meet each other? And her right hip is a little bit higher, so she has a C curvature. If she had an S curvature, it would be the opposite hip and the opposite neck, so it would make an S swagger, which I thought at one point she had years ago. I feel like my memory might not be the best, but it could very well be. When you work with something regularly, it might go from the S back to the C, whereas the S is really structural, where it's really moved a lot of bones. But anything, I believe, can be healed with intention and time. So certainly I've moved, and I haven't seen Rihanna in some time, and I did expect there to be a good amount of rib humping on this side, and there's some, but it's not as bad as I thought it would be, so I'm hoping that she's found some really good care. So I'm just going to loosen all around the hip itself. I'm working on the medialis. So gluteus medialis is into the TFLs, tensor fascia lata. Just let your palms kind of push and pulse off of that. And then again, you can manually open up that side, lengthening the QLs. So QLs is your quadratus lumborum. It connects from your lower ribs to your SI joint, and then even into the hip itself. I can lengthen that by pulling on her ankle. And I don't know if you can see me, but I'm down here pulling on her right ankle, and you can probably see what happened to the hip there. It drops the hips down and opens it up. As I did that, her ankle cracked. So if you ever feel a joint crack, just hold the stretch a little longer so that the tendons around it can get used to this new length. Synovial fluid can lubricate the joint, and then release it slowly so that it doesn't jar back. All right, I'm going to do that again, pulling the leg down, lengthening the lower back and the hips, lengthening the QL. If I wanted to strengthen the opposite side, I think we might be able to see me here, hey? Yeah, so I'm going to pull on her left leg, and it doesn't need a stretch, it needs strengthening to that lower back. So Rihanna, I'll encourage you to hike your hip up towards your shoulder for 6 seconds while I resist. Great, 6, 5, I'm pulling her ankle back, she's lifting her hip up for 4, 3, 2, and relax. As she relaxes her hip, I lean back for more of a stretch. And then I can do that 2 more times. So I'll hold the stretch and then get you to engage. When you're ready, pull your hip up. Great. 6, 5, 4, 3, 2, and relax. And as she relaxes, I lean back for a deeper stretch. And I'm going to leave it at 2 and not do a third, because she wasn't out that much actually, so I don't want to overcompensate. And now I'm just doing some spinal joint play. So my 2 hands come together. My top hand moves the vertebrae from sideways, and the bottom hand isolates them and doesn't move them. And this is a great way to assess where things are moving and where they aren't. When they feel locked up, stay there a little longer. Encourage it to move. It's a nice rocking motion, so it should feel pretty soothing. And then when you get right to the base of the neck, you might stop there so you don't wiggle their head around. Yeah, that's pretty much all that I can think of, other than I guess you could do more neck work to one side of the neck. If it was an exaggerated neck compression with it. Her neck was a little bit tight, like I said, on this side, and her hips were a little tight on this side. The thorax is really where she needs some good work. So the home care advice would be she really needs to stretch this side, and that just looks like this. I'm going to just touch my knee and laterally arch. So she'll laterally arch as I am from your right side over to your left and stretch out the intercostals and the ribs of the right side. The other side, if anything, she could have a soup can and do 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. Right? So she's doing ab work and shoulder work and a little bit of maybe even hip work that's raising and strengthening her lengthened side. So I think that's all that I can think about this point for scoliosis. Essentially, you're looking for concave and convex. The side that is the shortened side needs to be lengthened. You can do deep tissue to that side. The other side needs to be strengthened. You could do tapot mas, some kind of a drumming, rapid springy blow will help to tighten those muscles up. Other than that, stretching the compressed side and offering strength and resistance, or stretching and resistance work to the opposite side to strengthen it. I hope that was clear. It's a little bit tricky. Essentially, the tight side needs to be stretched and deep tissue work can be done on that side. The other side, rapid springy blows and strengthening techniques for home care. My name's Steffi, Inner Insights. Of course, if you have any questions, Steffi at Inner Insights, I'd love to hear from you. Take care and be well.